I am co-owner of CrossFit Elation in Downingtown, Pennsylvania. I am a level 1 coach. I'm an Olympic lifting certified coach through CrossFit, and I do a lot of mobility training for a lot of the gyms in the area. My personal schedule involves mostly CrossFitters, but I do tend to see our typical orthopedic patients, weekend warriors, but I also see post-surgical patients such as shoulder rotator cuff, labral repairs, hip and knee replacements, I should say, and just about anything else orthopedic. I've been a PT for 21 years. I graduated from the University of the Sciences of Philadelphia. I've been in outpatient orthopedics since I graduated 21 years ago. I think it's a perfect match. Coming from a PT background, you have to know how the body moves, how the muscles and the joints work together. And dealing with CrossFit athletes, there's a lot of motion that occurs, Olympic lifting, just general movements like squatting, pull-ups, jumps and everything else. So it's important for us to know the mechanics behind the movements that they do in CrossFit. So PT I think is actually a great fit because biomechanically we're probably one of the best ones that can help assess those motions. I would say there's not really anything that we can't work with HawkGrips. I see a lot of shoulders, I see a lot of knee pain, which is usually coming from the hip. So I do a lot of mobility and strengthening issues there. Back issues, neck issues, calves, we do a lot of jumping in CrossFit, so I tend to see a lot of tight calves and tendonitis type issues. So the most common injury that I see is a shoulder issues. Most of them come in with just twinges of pain, not a lot of chronic issues like tears or anything, but just occasional pinches that they feel when they lift their arms over the head in such activities like overhead pull-ups and overhead lifts like jerks and snatches and stuff like that. So what I'll tend to do, I'll just do a mobility assessment first, see where all the muscles are restricted. I'll do some special tests to rule out any kind of joint related issues or ligament related issues. But a lot of the times that I see that the CrossFit athletes come in, they're not really injured per se, it's usually a soft tissue type issue. So HawkGrips is an absolute perfect match for that. Usually working the scapular muscles all the way around, all the way from the neck into the upper trap, the scalenes, the rhomboids, the serratus, the lats, the rotator cuff, the pecs, the bicep, the triceps, all of those all attached to that shoulder complex. And once I work with all of that with the HawkGrips, it's amazing how quickly they turn around. Usually, I can get full pain-free range of motion within 2 sessions, two easy sessions, and then it's maintenance work after that. You're missing out if you're not using them. It makes the world of difference. This is the one treatment tool that I've started using in the last 4 years, and it has made the world of difference in treating anything. I used to be really deathly afraid of touching a shoulder because I never got better because didn't have the right tools to work with, but now that's actually the clientele that I prefer. I love treating shoulders and anything else soft tissue because it makes it so much easier.